Okay, so this is another sinus. So you can see in this area the grafted sinus, and then the sinus membrane is very thickened up above.
Yep.
This patient had come in, we had done a sinus augmentation, everything had gone smoothly, and then she came back about 2 weeks later with an infection.
Huh.
Which was kind of interesting because we always pre-medicate with antibiotics. Anyway, I won't go into the whole protocol that we use, but it was nice to be able to take the CT scan and kind of see the extent of what was going on in her sinus.
Yes.
So you can kind of compare this sinus to that one that we were just looking at. But I was able to see that it didn't, occlude the entire sinus.
Yep.
I could get a gauge for where she was at, and then prescribe some different antibiotics and put her on a regimen to help her things settle down. We haven't had her back in yet to see how everything healed up.
Okay.
But it's nice having that capability in office. Before I had a cone beam, if I had a complication like that, I had to send someone out to the office that did all my volumes.
Right.
And, then I would have to pay them for that volume.
Right.
And, hassle for the patient, hassle for me. And it's really nice. I think I bring this particular case up because to illustrate the point that it's nice just being able to do it in your own office.
Yep.
Be able to manage the complication, to look at what's going on, to assess the situation, and feel confident that you're seeing things completely.
Yep. Yeah. And I guess to your point, I guess the alternative is you're basically outsourcing it, and all not only the costs, but also the inconvenience for both you and the patient of, it's having them to go visit somebody else, and there's just more steps in the process.
Yeah. Yeah. Well, and the essence of time, when you're dealing with an infection, time is important.
That's a good point. So it's, how much longer it might have been before you could have assessed the situation if, you had to outsource this, and that actually could have had an impact on the infection itself.
Right. Exactly.
Yeah, that's a good point.